tonight.
It was in the spring of 2007. They detected a malignancy.
There are multiple tumors all over the liver.
An ABC 27 special presentation.
It was time for another CAT scan on my lung. And when I had that done, it caught the tumor in my liver.
Penn State Hershey Cancer Institute presents Liver Cancer, a Matter of Fact. Brought to you by Penn State Milton S. Hershey Medical Center.
Good evening, I'm Chuck Rhodes. The liver performs many important functions. It breaks down and stores nutrients and filters out toxic waste in the blood. A diagnosis of liver cancer can be scary, but it doesn't mean there isn't hope, as you'll see tonight. About 75,000 men and women will be diagnosed with liver cancer in the U.S. this year. Of these, approximately 30,000 have primary liver cancer, and about 45,000 are cancers that are metastatic to the liver. More than 95% of people diagnosed with liver cancer are 45 years of age or older. The average age at diagnosis of liver cancer is 63. Now tonight,
thanks, Chuck. A Cumberland County woman was given some news she didn't expect to hear. It's a 6-letter word that would shock anyone: cancer.
I have to get out a bathing suit, don't I?
Carol Rhodes is packing for a trip to Florida. Traveling is a favorite pastime of hers. It was put on hold after a routine visit to check a nodule on her lung.
The nodule is very tiny and it hasn't grown at all. And every 3 years I do have CAT scans on it. And it was time for another CAT scan on my lung. And when I had that done, it caught the tumor in my liver. And I had no other symptoms except that they said, you've got to get this checked. We have to biopsy it.
The biopsy showed a primary liver tumor, or a hepatocellular cancer. So this is a tumor that starts in the liver, made up of the cells of the liver. Usually there's some kind of genetic alteration within the cells that causes overgrowth and tumor formation. The mass measured 5 centimeters, or about 2 inches. Quite a significant mass within the liver, and it had probably been there for many months, if not years, because tumors grow relatively slowly.
You know, surprised. Yeah, but I don't know. I think I had a lot of faith. I really do. I think the kids were more worried than I was, and my grandchildren.
So one of the first things we do for any tumor is staging, where we try to see if the tumor has spread to the rest of the body. For Miss Rhodes, because she was found to have no spread and a healthy liver, we opted to offer her surgical resection with a plan to take out the tumor and allow the remainder of the liver to grow back and regenerate.
I wasn't afraid. I wasn't afraid. Because I think there's nothing, you can't do anything about it. Somebody tells you you have this or that. Yes, there's surgery, that's what I plan to do. Whatever the specialists tell me to do, that's what I thought, we'll take care of it.
We were able to take out the right side of her liver where the tumor was, taking about 55% of her liver. The remainder grew back beautifully and she recovered well from her operation.
After the fact, I did not need any chemo or radiation because they felt they got everything. They got it all. And there was no other cancer in my body. And they did take the complete tumor out.
She's doing great. She's a year and a half, almost 2 years out from her surgery and has recovered fully. Her liver has regenerated nicely and she has perfect liver function and she's back to her normal life.
I always overpack. I mean, I know it's scary, but you have to just stay strong and you'll get through it.
And she got through it. Carol has CAT scans every 3 months. After 2 years, it will be pushed back to every 6 months and eventually once a year. Chuck, back to you.
thank you, Deborah. And joining us now, Carol's doctor, Dr. Niraj Gasani. Doctor, there were extensive type of surgery Carol had. How long a recovery? Talk about that surgery and the recovery time on it. It seems almost overwhelming from
Sure.
this point of view.
Absolutely, Chuck. The liver is a very wonderful organ in that it regenerates after we remove parts of it. And so we can remove 70, even 75% of a normal, healthy person's liver, and it will regenerate to full function within 3 weeks. However, the surgery is very extensive. Ms. Rhodes had over 50% of her liver removed. But these days we can do these even very extensive operations in a minimally invasive fashion with small incisions and a quicker recovery time for the patient. Patients do spend between 4 and 7 days in the hospital, and could be longer sometimes. And the usual recovery period is about 2 months.
Now, we talk, many of these shows, we talk about multidisciplinary approach. How does that work in your case, in this department?
Yeah, well, this is very important in cancer care. There are a lot of different specialties, and we all have a different role to play in treatment of cancers. And so at Penn State, we bring together all the specialists who treat liver cancer. This includes surgical oncologists like myself, transplant surgeons, liver doctors called hepatologists, medical oncologists and radiation doctors, and special radiologists, all in a room to talk about every patient and build a plan tailored to each patient's needs.
Putting them all under one roof like that just keeps
That's
it
right.
keeps it
One-stop
moving on.
shopping, and it makes it better for the patient because we all communicate in real time, and we can see the patient together in our clinic.
You see them right down the hall instead of email, hoping for
That's
the best.
right. Exactly.
That's very good. And we're going to check in with Deborah now on the ABC 27 call center. Deborah?
Thanks, Chuck. It is very busy over here right now. You can see the specialists are on the phones. This is the number to call, 717-346-3333. If it's busy, you can try back again or also use the email. Now, here to help us answer some of the viewer questions this evening is Dr. Thomas Riley, a hepatologist at the Med Center. Thanks for being with us. This is our first question. Does a diagnosis of a fatty liver raise my risk of getting liver cancer? What causes a fatty liver, and is there a way to reverse the condition?
Well, fatty liver disease is one of the most common conditions in the United States today causing liver disease. And about 20 to 30% of the people who develop a fatty liver will progress through stages from fatty liver to inflammation to fibrosis and cirrhosis. And when cirrhosis sets in, that's when your cancer risk of the liver starts. We can try to intervene and try to stop that progression by seeking advice from your physicians. They will give you advice on losing weight, exercise, potentially vitamin E.
Okay, thanks, Dr. Riley, and we will come back to you with some more viewer questions. If the phone lines are busy, here's the email address. You can email your question to questions@abc27.com. Stay with us. We will be right back.
You're watching Liver Cancer, A Matter of Facts on ABC 27, brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. A Lebanon County woman was diagnosed with one kind of cancer, only to find out more devastating news. The cancer had spread to her liver. There's snow on the ground. The temperatures are well below freezing, and Marion Cuddle is out feeding the birds anyway.
I enjoy feeding the birds. I just like to watch all the different birds come to the feeders.
This is part of Marion's daily routine, but her routine was interrupted by a doctor's visit.
In the spring of 2007, I had a colonoscopy, and they detected a malignancy. So I went and saw Dr. Colton, and he scheduled surgery.
We thought the colon cancer was relatively straightforward, that it was probably caught relatively early because she had had a colonoscopy a few years before. But everyone gets a CAT scan and gets evaluated for the possibility of spread. And that CAT scan in her case unfortunately came back positive, showing tumor had gone to her liver.
Kind of took the wind out of my sails. Yeah, because I knew that was very serious.
It was serious. Marion had stage 4 colon cancer, the most advanced form.
Well, it was a little overwhelming. At first it was, and I got to say it upset my family quite a bit.
When we looked at her CAT scans, shown here, we can see outlined in red that there are multiple tumors all over the liver of varying sizes and shapes. And in fact, she had even more tumors that we can't see on these images, representing 8 to 10 tumors spread throughout her entire liver.
Because the tumor in her liver was rather extensive, we decided, after talking with Dr. Gasani as well as the oncologists here, to give her chemotherapy, which would effectively go everywhere in her body and treat whatever cancer was there.
She received what is called standard therapy for advanced colorectal cancer, which is combination chemotherapy with several agents.
I was going to get chemo every other week for about 8 weeks. I was watching my 5 grandchildren at the time, and they kind of kept me going. They gave me a reason to get out of bed in the morning, and they just kept me going.
Inspiration when Marion needed it the most.
When we see a patient like this, our strategy in working with the surgeons is to try and provide chemotherapy and demonstrate that the tumors are shrinking.
Here you can see one of her tumors in the right side of the liver before chemotherapy, and here we can see immediately after chemotherapy how nice of a response she had with the tumor shrinking significantly. We reassessed both her liver and her colon tumor, and these had both responded quite well to the chemotherapy.
Before surgery could take place, radiologists were called in.
Because of the extent of the disease and the number of tumors in her liver, we felt that her liver remnant wasn't quite large enough. And so we did a special procedure called portal vein embolization, where we actually block off the blood flow to the side of the liver we're going to take out. And this allows the liver to grow even before we do the surgery and to prepare it for having enough healthy liver tissue after the operation.
Marion's liver regenerated, so surgery was next.
I was a little nervous about it, but I wasn't really scared. I kind of had faith in my doctors, and I just knew whatever happened, I was going to be all right.
This was a very extensive liver operation, one of the biggest ones we can do. We took out about 70% of her liver, taking out one entire side and taking pieces from several other portions of the liver to completely remove all of the tumors.
I woke up again, and they were able to tell me pretty soon after the surgery that my liver was regenerating itself. So that was good news. That was good news.
Marion successfully made it over one huge hurdle, but had a couple more to go, including 4 more chemotherapy treatments.
The rest of the treatments she received was to complete a total of 6 months of chemotherapy for disease that was ultimately completely removed by surgery.
My daughter took me home after my last treatment, and she said, well, she said, with any luck, this will be the last time. And it was.
Colon surgery was the final step, and Marion was ready.
I was feeling pretty good by that time, because I knew the main problem, which was the liver, seemed to be all right.
I basically took out a piece of her colon that had the tumor within it. And in fact, when we took out her colon in that area, there was no tumor left to be seen under the microscope. The tumor had responded very dramatically in her colon, just as it had in her liver.
2 surgeries, chemotherapy, and a number of procedures all done in a year's time. 7 years later, now it's a distant memory for Marion.
Yeah, sometimes when I look back on it, I think, wow, I really went through all that. I wouldn't want to go through it again, but at the time, you just do what you have to do.
Marion gets a CAT scan once a year, but at this point, she feels as though she beat cancer. Chuck?
Deborah, that's good news. And joining us now, Dr. Peter Waybill, and along with Dr. Gasani. But before I start with you, Dr. Waybill, Dr. Gasani, do we see a lot of patients where cancer spreads from the colon over to the liver?
Yeah, Chuck. In fact, colon cancer is one of the most common cancers in the United States. It's the third most frequently seen cancer in both men and women, and 150,000 Americans are affected with colon cancer every year. Up to 40% of those patients present with spread, and the most common site of spread is the liver. So in fact, colon cancer spread to the liver is the most common liver tumor that we see here in the United States.
And Dr. Waybill, now we talked about various specialists all throughout this program dealing with liver cancer, the team. Talk about the interventional radiologists. That sounds really technical. What's that mean?
Interventional radiologists are physicians who specialize in the use of radiologic procedures, X-ray, CT, MRI, and ultrasound to guide therapies and treatments. In the case of liver cancer, several options are available. We do procedures called chemoembolization and radioembolization, where you will put a catheter into the artery in the leg, run it into the vessels that supply the liver and directly into the blood vessels that supply the tumors in the liver, and deliver specially formulated chemotherapeutic agents to the liver or specially formulated radiotherapy agents to the liver. And we'll also put other image-guided things in to use microwaves or radio waves to ablate tumors, kill tumors.
Now we saw in Marion's story that she had a very important procedure prior to the surgery. What's that involved?
So she had a portal vein embolization, and for many people, when you have your right lobe of your liver involved, it is the majority of your liver. And if there's a lot of disease there and they are required to cut out the entire right, there may not be enough liver left to live on. And those people in the past, they would have been deemed inoperable. Now we have a procedure called portal vein embolization where we will go in and actually put material into the right side of the blood vessels, slow blood flow there, and that actually stimulates the left lobe to grow. And hopefully it grows enough that there'll be enough liver left that when they take out the diseased liver, there's enough good liver to live on. And those people who were inoperable before now can be operable.
How long has that procedure been around?
Procedure's been around for about 5 to 10 years, but it really is taken off in the last 2 to 3, where you have a center that has specialists like Dr. Busani who do these high-end liver surgeries. They require that to help them do what they need to do.
Okay, well thank you, Dr. Waybill, for joining us tonight. Dr. Busani, you're staying with us. And now we throw it back over to Deborah in the call center again. Deborah?
Thanks, Chuck. Here's our next viewer question. Dr. Riley, both my grandfather and uncle on my father's side of the family were diagnosed with liver cancer. Does this increase my risk of getting liver cancer?
That's somewhat of a complex answer because first you have to inherit the liver disease that the relative had to then go on to develop liver cancer. So if you don't get that liver disease, then you would not go on to develop liver cancer. So it's important that you work closely with your physician to decide whether you may have inherited that liver condition to work with that question.
So you should get tested. Ask your doctor about getting tested.
Absolutely.
Okay, Dr. Riley, thank you. As you can see, the phone lines, they are very busy at the moment. Now, you can do something else. You can email a question to questions@abc27.com. We will be right back. Stay with us.
Liver Cancer, a Matter of Facts on ABC 27 is brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. You still have a few minutes to get your calls in. You can see the lines are still busy. We still have our email address. That number is 717-346-3333. Once again, we do want to thank these specialists for coming in this evening and answering your phone calls. Once again, the lines are open until 8 o'clock. Chuck will send it back to you.
Thank you, Deborah. And joining us now is Dr. Thomas Riley. You saw him over answering all the viewer questions over there. And Doctor, we talked about different types of liver cancer here tonight. What causes liver cancer? Pretty basic question.
The most common reason someone develops liver cancer is that starts in the liver is cirrhosis of the liver, which is a scarring of the liver that happens for a variety of reasons. But the most common reasons in the United States are fatty liver related to obesity or alcohol. It can also happen from hepatitis B or C, or from autoimmune or genetic liver diseases. Once we detect somebody with cirrhosis, we can then set up a screening program to try to detect that early so we can put them in a position to more likely cure their liver cancer.
Now, besides surgery, chemotherapy, talk about some other treatments.
Well, liver transplantation is an excellent option when people meet the criteria. And we have assembled an excellent team at Penn State to deal with that, where we have transplant surgeons, transplant hepatologists, anesthesiologists, We have radiologists, pathologists, infectious disease doctors, cardiologists, nutritionalists, social workers, and all working together to help take care of these complex patients.
Let's talk about that transplant. Who's eligible and what's the criteria for that?
Well, first you have to be medically suitable. You have to be able to tolerate that very big, large operation. And then once that's met, you then have to have two criteria met in the size of your cancer. You have to have a lesion less than 5 centimeters or 3 lesions less than 3 centimeters. And when those criteria are met, the outcomes of liver transplant are excellent, equal to any other form of liver transplant.
How do you go about finding donors?
That can be tricky, but yet people could have their own family members give live donor transplant, and the waiting list often allows most of the people with liver cancer to successfully receive a transplant. 90% of the people who get listed for transplant with liver cancer successfully receive their transplant.
Dr. Gasani, I know it's not an easy ABC type of answer, but talk about survival rate for someone diagnosed with liver cancer.
Sure, Chuck. Well, I think the most important message is that these can be curable tumors. Surgical treatments like transplantation that Dr. Riley described, surgical removal of liver tumors, as we saw in our 2 patients, can cure patients with liver cancer if we find it early enough. Unfortunately, a lot of liver tumors are found at advanced stages, and for those patients we also have treatment options, sometimes not curative, but which can prolong life and give people an excellent quality of life.
Well, it sounds like there's been dramatic progress and constantly making progress in fighting liver cancer. What about, compare that to, say, 10 or 20 years ago. How do we stand?
Absolutely. Everything has changed in the last 10 or 15 years with regard to liver cancer. We have newer chemotherapies, both for hepatocellular cancer or primary liver cancer, as well as colon cancer and other tumors spread to the liver. We have better technology. We're able to do bigger and more extensive liver resections with combinations of interventional treatments like what Dr. Wabel described. We're able to do these big operations now minimally invasively. Mrs. Rhodes had a minimally invasive hepatectomy and was home within a week after her surgery. Small scars, less pain, and faster recovery. So it's a very good time if you are unfortunately diagnosed with liver cancer to have your treatments in a multidisciplinary fashion, and we can provide excellent outcomes.
Is there any set rule on what we can do to maybe prevent liver cancer?
Sure. That's the most important question and the one on everybody's minds. It can be very difficult to prevent liver cancer, but the most important principles are a healthy liver lifestyle, which includes using alcohol in moderation, as well as you know, there's an obesity epidemic in the United States, and fatty liver, as Dr. Riley talked about, is one of the most common upcoming causes of liver cirrhosis and liver cancer in the United States. So you have to watch your cholesterol and watch your diet.
Well, besides the alcohol, any particular foods you should kind of steer away from?
Sure.
That directly hit the liver?
Well, it's similar to a heart-healthy diet, something that lowers your cholesterol, low in fats, and combined with exercise can keep your cholesterol low and prevent fatty liver.
How important, I noticed when we saw the 2 stories tonight about how they were treated and so on, what about attitude of the patient?
Well, that's critical. Obviously, these are tough diagnoses, and patients can have difficulty dealing with the news. But with a positive attitude, it's very important that they also understand that they're going to need a lot of support. The family is important in helping the patients through these multiple treatments and in helping to keep the patient's outlook good. The other thing that we recommend is physical activity. It's critically important with any kind of treatment that the stronger you are going in, the better chance you have of recovering faster and healthier.
A lot of progress has been made, so
yes, sir.
Thank you, doctors, for joining us here tonight.
Thank you.